Doctors is joined by leading consultant psychiatrist Dr. Richard Bowskill. Leading mental health charity Mind says that in any given week in England, depression affects 3 in 100 people. And since the pandemic, statistics are getting higher. Today, we're discussing this serious condition, its wider impact, and how it's treated. Good afternoon, Dr. Bowskill.
Hi, Carolyn.
Hi, it's really nice to have you here. Really great. So could you tell us more about yourself and your work?
Well, I'm a consultant psychiatrist. I've been a consultant psychiatrist for a number of years now, and I currently work in a private clinic. Previously, I did a lot of NHS work, and so I've been involved in treatment of mental health problems for quite a few years now, and I've seen a wide variety of different ways that depression can sort of present and affect people. So I've got a wide range of experience of treating depression. And a number of years ago, I did work in a specialist unit that just dealt with depression, with treatment-resistant depression.
Great, thank you. Okay, so let's get started with the questions. How do people know it's the right time to get help for depression? I know, like, lots of people say it's good to talk about it, but what, for example, if you don't want to, or maybe you aren't even aware of it? So what can they do?
Well, it's a good question about when to sort of present for depression, how to sort of present for depression, and it's incredibly variable. I mean, some people actually have depression for a number of months or years without getting sort of help, and with a lot of mental health problems, there's quite a lot of stigma about accessing help. So often people sort of end up developing problems and having sort of difficulties in functioning. And usually the usual sort of case is that they tend to delay sort of treatment and delay presentation for a bit too long. And it's obviously better if people sort of come earlier. In terms of how you know about whether you've got depression, I mean, usually people can feel sort of the depression sort of starting. They don't get pleasure from things. They don't get any interest or joy from things, and they obviously feel their mood is sort of persistently low, and sometimes get really tired and fatigued. Sometimes it can be triggers for the depression. So sometimes it can be life events that sort of bring it on, but not always. Sometimes it can just come out of the blue and just gradually sort of creep up on people. And that's the type of depression that people often find more difficult to sort of know when to get help, because they sort of, it gradually comes on and it gradually affects them. And sometimes it is quite hard to be self-aware of when the depression sort of comes on and affects you. So
Yeah, absolutely. Maybe, for example, family or friends might notice or something like that, and they can give them a helping hand. Yeah, it's very interesting.
yeah, no, I mean, often family are involved in supporting people to sort of get help, and so it's often family members, you know, they'll be talking to the husband or their son or their daughter and sort of say, you know, look, you're not yourself. And this has been a long time now. You're not sort of functioning as you normally do. You've changed in some sort of way, and then often, so it's often family members that support people into getting help. And I think one of the key things with mental health, one of the key problems with it in terms of people realizing they're getting depressed, is that you often don't feel the depression is separate from yourself. You often just feel like it's you that's sort of changing. Whereas if you've got a physical health problem, like, you know, a bad knee or a bad thumb, you know, it's sort of external from you, but the depression sort of feels like it sort of almost becomes an integral part of you. And you can't always sort of see it separate from yourself. So I mean, that's one of the reasons why often one of the reasons why people do delay sort of treatment and delay sort of getting help. But also one of the reasons why they find it hard to sort of sometimes people find it hard to understand that they are depressed when actually that's the problem that's causing the issue.
Yeah, sure. So how is depression diagnosed? And what signs and symptoms do you look out for?
Well, I mean, unfortunately, we haven't got in psychiatry, although we scanning and things like that are being used more in research and things like that. We can't sort of scan people, or we can't do blood tests and things like that yet to sort of see which bits of the brain aren't sort of functioning properly. We do think there are bits of the brain that become underactive and other bits that become overactive in depression, but we can't use that sort of clinically yet. But so we still rely on sort of a history, sort of talking to the patient, knowing what symptoms they present with. And the three sort of classical symptoms are obviously depressed mood. So you don't get sort of, you feel low and you feel tearful. The depressed mood, lack of interest and lack of ability to get pleasure from things, and then feeling tired and fatigued. Those are the sort of classic sort of three symptoms that people usually have. And then there's a whole host of other other additional symptoms that people can have. I think also so-called biological symptoms. So if they can't sleep, or if they wake up early in the morning, or if their appetite changes in some sort of way, those sort of physiological things can change. But also thinking patterns change as well. So people become, generally negative about themselves. Their view of themselves change. Sometimes their view of the future changes. They start feeling hopeless. Sometimes guilty thoughts and lots of remorse, even when it's not really justified. So it can affect quite a whole range of different symptoms. We put those together in a sort of a syndrome, and then sort of make the diagnosis. And also it's got to carry on for a certain period of time. Obviously, it's not, you've got to have depressive symptoms at least for 2 weeks before the diagnosis is properly made.
Sure. So what type of treatment and support is provided from a psychiatric perspective, and what can this support help to relieve?
Well, it depends on the severity, obviously. So I mean, for people with mild and moderate depression, usually they're sort of functioning to a certain extent. They may be going to work or managing to be with families, but they're functioning to a certain extent. But often they sort of withdraw from people and don't do their usual activities. And then so one of the types of treatment is called behavioral activation. So it's about how to keep people engaged and active, and maybe exercise, and sort of make sure that sort of people are engaged in their lives properly. And then there's things like cognitive behavioral therapy, which is a more sort of formal psychological treatment. And then, of course, antidepressants as well. Antidepressants which usually they boost serotonin, which we think is underactive in depression. And so those are the broad sort of three types of treatment. But also you have to be careful about people's risk as well, because obviously, if you're starting feeling hopeless about things and negative views about yourself, and also suicidal thoughts can sort of come up and be a sort of a big problem. And that indicates, sort of the amount of support that you need. Sometimes people need intensive support or even inpatient treatment if they're of a significant risk. So yes, there's a wide range of different types of support that can be useful for people. But I guess maybe we sort of should have started with the most important thing is realize it's a really treatable condition. So and I think even though people often don't have experience of it themselves, the first time they get depressed, that's maybe the first time they're experiencing it, and they maybe have preconceived ideas about what depression's all about and how it affects people. But it is really, really treatable condition, and most people sort of recover from it and get better.
That's great to hear. That's something positive. That's great.
Yes.
So does depression always require psychiatric support? Or, for example, is a psychiatrist better, or is a psychologist better, or maybe therapy?
Well, I think it depends. It depends on the severity, obviously, and I mean, I think a good starting point is a psychiatric assessment, because that sort of looks at a broad assessment. If the depression is sort of significant enough to be affecting functioning, or if it's gone on for a long time, because sometimes some types of depression sort of go on for a long period of time and affect functioning sort of gradually over a longer period. So I think it's good to get a a psychiatric assessment first if there's significant symptoms, and the psychiatrist usually guides you about what type of treatment's best, whether it's therapy or therapy and antidepressants, or the sort of behavioral activation stuff. So if you've got any doubts, if you've got any sort of uncertainty, or if maybe you've tried counselling and it's not working and you haven't got better, then it is good to get a psychiatric assessment. But obviously I'm a bit biased because I'm a psychiatrist myself, but I do, I think generally a really good assessment is a good sort of starting point. It's one of the things, if you think about it, we talk about depression, and that's, it means different things for different people, and even from a medical perspective, there's a lot of different types of depression, and we don't, that we often find it hard to sort of describe what those are, and so you've got to really try and work out what the type of depression is to sort of guide sort of treatment more effectively. And sometimes depression can be treated by other physical things like underactive thyroid, or anemia, or diabetes, or other sort of hormonal problems. So there's a whole range of different physical things that can trigger depression as well.
Interesting, very interesting. Next question. It's been reported that a small amount of people, around 1 in 8, are actually getting any kind of treatment. So for people who are ready to seek medical help, what should their first steps be?
Well, I don't think people don't have to sort of necessarily sort of just understand they've got depression. I mean, as long as if they understand there's something different about them, they're not functioning the same way as they used to, or they're not feeling in the same way they used to. I think a fairly good starting point is seeing your GP. So GPs treat a lot of depression, and they're very familiar with treating depression. Unfortunately, they don't have much time often. Their appointments are short, but they tend to sort of, if it's a mental health problem, they tend to give double appointments and things like that. So GP is your first sort of starting point. And then if you feel, I think obviously GPs have got different, I don't know how GPs do it. They have to deal with such a wide variety of different sort of conditions. But if you're unlucky enough to come across a GP that isn't particularly interested in mental health, or you think you're not being listened to, then you can sort of approach people for specialist assessments as well, approach psychiatrists. So I think sort of believe if don't be dismissed. I suppose that's what I was trying to sort of say. If you feel that you're not being listened to by a GP, either go again, maybe the GP didn't get it right, or sort of keep on sort of knocking at the door, or sort of try and get a specialist assessment if you can.
Absolutely, there is support out there. So if you know someone who is depressed, how can you support them, especially when it comes to encouraging them to get support?
Well, I mean, that's what I said. Sometimes people sort of have strange sort of prejudices against the word depression, especially people that are older. If you speak to sort of an older person, they say, "Oh, I don't want to be having depression. I don't think I've got it." But if you sort of say, "Well, not sleeping very well, you've lost interest in and frame it in a different way," sometimes they'll accept treatment. They're just scared of the word. So I don't think you have to sort of sort of batter people and sort of make, do you agree that you're suffering from depression, and then go and get some help. You just got to accept that things aren't quite right for you, and get some sort of support, and then the sort of range of packages of care can be around you. And always remember, it's the other thing that people sometimes fear is that the psychiatrists are going to sort of take them away, or take away their decision making from them. But 99.9% of interactions with psychiatry, it's the person, the patient, that's in control, and using the psychiatrist as a resource to find out what the best potential sort of treatments are, because there's a whole range of different treatments. And when you're going through depression, there's sort of lots of different strata about sort of what stage 1 is, then stage 2, then stage 3, and sort of progressively going up steps in terms of effectiveness. So there's a lot of different sort of options there. And what you don't want to do is just have one treatment followed by another treatment by another treatment. It's all the same. You need to sort of like progress up sort of effectiveness. So is that I don't think I answered your question. What did you actually say? What did you ask when we asked for that one?
It was about how if you
How to
know
support people.
somebody, yeah, that's depressed, so how can you encourage them to get support?
Well, I mean, obviously, I mean, really simple things like sort of saying, I'll come to the appointment with you. I mean, the majority of psychiatrists are absolutely fine for having, the person and a relative or person and a friend in the assessment to begin with. I mean, obviously, at some stage it's nice to talk to somebody by themselves, but not necessarily. And wait, they can be with you can be accompanied all the way through the first assessment if you want. So just get somebody to just go up and have the assessment together. Sometimes when people sort of end up sort of self-medicating with alcohol, or there's other sort of things going on that people feel they're embarrassed about or ashamed about, then that can be a barrier to sort of people accessing help. But we understand that life's complicated and all types of different complications and issues can sort of happen. So majority of psychiatrists aren't judgmental. They'll just listen to what's going on and try and work out a way with you in partnership about what's the best way to sort of move forward. So you're not going to have medication forced on you or sort of other treatment sort of it's a partnership about what's going to be beneficial and what might help people sort of move forward. But again, getting back to that key thing that it's a treatable condition and most people sort of recover. And often the biggest problem is people just living with the symptoms for a long time, and being scared of approaching sort of people for proper treatment.
Sure, absolutely. Well, thank you so much. That's been really, really informative and really interesting. And yeah, just it's a topic that I'm really interested in. So yeah, I'm really happy to have spoken to you, definitely.
Okay, good. We didn't talk much about the sort of the theories of depression and sort of how life events can interact with genetics and that can sort of trigger off depression. So sometimes it is one of these conditions where it's not just a sort of a life event thing. Sometimes even when a life event, people imagine if there's a cause for it, like there's a big life event, a big trauma, then medication might not be useful. But sometimes the life event can bring out sort of genetic susceptibilities and things. So it's it's a complicated mixture between sort of biological and sort of normal responses, and that's the key to sort of try to that's the key of making the assessment, to try and work out where the balance is between sort of psychological things and medical things.
Yeah, absolutely.
Yeah, it's a really good area to treat. Everybody sort of says, how can your interest be depression? It's sort of because it's sort of like you said, Friday afternoon, here we are talking about depression, but actually it can be incredibly rewarding getting people from they walk through the clinic, they don't really know what the problem is, often very fearful about accessing treatment, but with the right support, often you can get people sort of through it, and so it can be really rewarding from that perspective as well.
Fantastic. That's great. Okay, so if you have a family member or friends that requires expert psychiatric assistance, visit Dr. Bowskill's profile at topdoctors.co.uk to arrange a consultation.